Cell injury. It has four aspects and it has two types, that is reversible and irreversible. Irreversible cell injury includes necrosis, apoptosis and some other patterns. Some other patterns includes necroptosis, pyroptosis, ferroptosis and adaptations. Adaptation again includes five types: atrophy, hypertrophy, hyperplasia, dysplasia and metaplasia. Intracellular accumulation, five types: protein, lipid, endogenous pigments, hyaline, again intracellular or extracellular, calcification, dystrophic or metastatic. Next, reperfusion injury leads to cell aging and free radical injury. Now in brief, what is pathology? Pathology is the science that deals with the study of disease. It has four aspects, that is etiology or cause, pathogenesis or mechanism of the disease process, or morphological change that leads to structural changes in the disease process of the cell in disease process, and clinical features or clinical manifestations. Now the cause of cell injury: hypoxia, physical agents like radiation, burns, chemical agents, drugs, poisons, infections, bacteria, virus, fungus and parasites, immunological reactions, hypersensitivity reaction and autoimmune diseases, genetic causes that include sickle cell anemia, and nutritional imbalances. Nutritional imbalances includes overnutrition that will lead to obesity, cancer, diabetes mellitus, and undernutrition that may lead to protein energy malnutrition. Now the reversible cell injury. It includes some of the organelles and parts of the cell, that includes cell membrane, mitochondria, endoplasmic reticulum and nucleus. Mitochondria is the faces the earliest involvement. Now how it proceeds: due to ischemia, blood supply reduces, that will lead to mitochondrial affection and decrease oxidative phosphorylation, decrease ATP content. Now as the sodium potassium ATPase pump is affected, so the organelles which require ATP for its functions are affected. So as the water imbalance takes place, more accumulation of the osmotically active particles inside the cell that will draw water inside it and lead to swelling of the cellular organelles like mitochondria, endoplasmic reticulum, etc., and cellular blebbing. Next, loss of microvilli, formation of myelin figures, cellular organelles and phospholipid degeneration cause. The types of changes that takes place in reversible cell injury: hydropic change, that is the earlier change. Other changes are vesicular degeneration, degeneration of the blood vessel and the fatty changes. Next is irreversible cell injury, that will lead to damage to the cell membrane, calcium influx and nuclear changes that includes pycnosis, that is nuclear condensation, karyolysis, nuclear dissolution, karyorexis, fragmentation of the nucleus. Next is its mechanism. Prolonged ischemia leads to decrease in ATP content to a much lesser extent, that will cause activation of some enzymes like proteases that will lead to protein damage, nucleases lead to nuclear damage including pycnosis, karyorexis, karyolysis and phospholipase that will cause plasma membrane damage. Calcium deposition in mitochondria causes amorphous density inside the mitochondria. Now, irreversible cell injury includes necrosis and apoptosis. Necrosis has six types: coagulative, liquefactive, caseous, fat, fibrinoid, and gangrenous. In coagulative necrosis, the cell architecture is preserved and it is the most common type, seen in all solid organs like heart, liver, kidney, except brain. Now the liquefactive necrosis, the cell architecture is lost, seen in brain. Caseous necrosis is the intermediate between the coagulative and liquefactive necrosis seen in TB. Fat necrosis, activation of the lipase enzyme seen in tissue organs involving fat metabolism like pancreas and pancreatitis and omentum, breast, etc. Fibrinoid necrosis, complexes of antigen antibody are deposited in the blood vessel and fibrinogen leaks out of the blood vessel in pan, that is um, Pan and Ascoff's bodies, rheumatic heart diseases, malignant hypertension, fibrinoid necrosis takes place. Gangrenous necrosis, it has two types, dry gangrene and wet gangrene. Now the apoptosis. Apoptosis has two pathways, one is extrinsic and one is intrinsic pathway. Extrinsic pathway includes two ligands, that is trail and fast ligand. Trail full form is TNF related apoptosis inducing ligand that will bind to the death receptor 4 and death receptor 5. The first ligand will bind to the CD95 or FAS. Now they will be associated with FAS associated death domain and activates the pro-caspase 8 to caspase 8. Now through the intrinsic pathway, cytochrome C will be released from the mitochondria, binds to the APF1, that is apoptosis activating factor 1. It will form a wheel-like hexamer apoptosome that will cause activation of the caspase 9. And in another way, release of SMAC or Diablo. SMAC stands for second mitochondrial activator of caspase that will bind and neutralize the IAP, inhibitor of apoptosis protein. Now we can see through the extrinsic pathway caspase 8 is activated and through the intrinsic pathway caspase 9 is activated. Now combined effect, activation of the caspase 3 and caspase 7, substrate cleavage and morphological changes of the apoptosis. Now the regulation of the apoptosis, anti-apoptotic factors that will lower the apoptosis, L for lower, and the factors will also contain L. They are BCL2, BCLXL, MCL1. Pro-apoptotic factor, they will stimulate apoptosis, stimulate for S. So BCL, XL, BED, BEAM, BEAD, PUMA, NOXA and P53. Diagnosis of apoptosis includes chromatin condensation, estimation of annexin V, and DNA breakdown at specific sites can be detected by step ladder pattern on gel electrophoresis. Now the difference between necrosis and apoptosis. We will learn it through a mnemonics. Murder is as consider apoptosis as suicide, whereas necrosis as murder. Murder is always done by someone else, that is pathological always, but suicide can be done by oneself or by some other pressure from outside. That means it can be both pathological or physiological. A person can murder many person, so the necrosis affects a bunch of cells, but apoptosis, suicide is done by oneself, so that it includes a single cell. Now when it is being conducted during suicide, uh, it doesn't help external help, so there is no inflammation or accumulation of the mediators. But in murder, the person who is being murdered seeks for help and try to accumulate police and equivalents, so that will lead to inflammation and accumulation of the mediators. Now the other patterns of irreversible cell injury are necroptosis, that is caspase independent programmed cell death; pyroptosis, apoptosis occurring in cell infected by microbes, includes caspase 1 activity; Ferroptosis, iron dependent pathway induced by lipid peroxidation. Adaptation, 5 types of adaptations: atrophy, hypertrophy, hyperplasia, metaplasia and dysplasia. Atrophy leads to reduced size, disuse atrophy. Hypertrophy, increase in size, seen in puberty lactating breasts. Hyperplasia, increase in cell number, seen in breast development at puberty. Endometrial hyperplasia. Metaplasia, this is a reversible change. That means one type of cell when required changes into another type of cell reversibly. Results from reprogramming of the stem cells that are known to exist in normal tissues or of undifferentiated mesenchymal cells in the connective tissue. Now in dysplasia, one parent cell that remain unchanged, but due to its multiplication other type of cell that is of other size, shape and loss of cellular organization is formed. Basement membrane is remain intact. Next, intracellular accumulation. First is protein. Two types of protein, chaperone and heat sensitive lipase. Chaperone will degenerate the misfolded protein via ubiquitin proteasome complex, and the heat shock protein will prevent misfolding of protein. Now lipids. Accumulation of triglycerides, cholesterol and complex lipids like sphingolipidosis. Next, endogenous pigments includes lipofuscin, melanin and hemosiderin. Lipofuscin is a brown colored pigment, perinuclear. It is seen in brown atrophy of liver and heart, protein energy malnutrition and cancer, cachexia. Melanin, it is a black colored pigment from tyrosine and seen in hair and skin. Hemosiderin, it is a golden yellow pigment, site which is hemorrhage or bruises, also seen in hemochromatosis, iron overload. Hyaline changes, it can be intracellular or extracellular. Intracellular hyaline changes includes Mallory body, Russell body and Jenkar hyaline change, and extracellular hyaline change includes hyaline membrane in newborn, hyaline atherosclerosis, corpora amylaceae in prostate, brain, spinal cord in elderly, old, lung infects, etc. Next is calcification. It can be dystrophic or metastatic. In dystrophic calcification, it is seen in dead tissue with normal calcium level suffering from necrosis and leads to organ dysfunction. Metastatic calcification seen in living tissue associated with elevated calcium level do not cause clinical dysfunction. Now example, dystrophic calcification, rat. R for rheumatic heart disease, A for atheromatous plaque, T for tubercular lymph node and tumor. Tumor includes most for PG, M for meningioma and mesothelioma, O for papillary carcinoma of ovary, O for ovary, S for papillary carcinoma of salivary gland, S for salivary gland, T papillary carcinoma of thyroid, P for prolactinoma and G for glucagonoma. Next example of metastatic calcification, hyperparathyroidism, renal failure, vitamin D intoxication, sarcoidosis, milk alkali syndrome, multiple myeloma and metastatic tumor of the bone. It is most commonly seen in lungs. Next is reperfusion injury. After the ischemia, when the perfusion is restored, then more recruitment of the white blood cell to that region causes inflammation and degeneration of more generation of more free radicals, that is seen in myocardial infarction and leads to aging. Now the mechanism of aging. Telomere shortening, that will lead to replicative senescence leading to cell injury. Environmental insults leads to free radical accumulation, damages to the protein or organelles. DNA repair defects leads to DNA damage. Again, free radical can also lead to DNA damage, or calorie restriction lead to activation of sirtuin that will also cause DNA damage. Ultimately, accumulation of the mutants and leading to cellular aging. Cellular aging will cause Werner's syndrome, that is premature aging. Telomerase activity decreases with aging and increases in cancer. Now, free radical injury. It occurs via four mechanisms: oxidative stress or reactive oxygen species, radiation exposure, drugs like carbon tetrachloride, paracetamol, and metals like iron, copper. Now, the mechanism of free radical injury, and to prevent it, there are antioxidants. It has two types: enzymatic and non-enzymatic antioxidants. Enzymatic antioxidants includes superoxide dismutase, catalase, and glutathione peroxidase. Non-enzymatic antioxidant includes vitamin E, sulfhydryl containing compounds, cysteine and glutathione, serum protein, albumin, ceruloplasmin, and transferrin. Now, the process: the superoxide anion converted into hydrogen peroxide with the help of enzyme superoxide dismutase. So hydrogen peroxide is again converted into water with the help of glutathione peroxidase, and in this process reduced glutathione is converted into oxidized glutathione. Again, the hydrogen peroxide can be converted into water with the help of enzyme catalase. Hydrogen peroxide is produced as well as destroyed in peroxisome, but lysosome only produces hydrogen peroxide, does not destroy it. That will lead to imbalance. Now, some chemical fixatives. For light microscopy, fixative is 10% neutral buffered formalin. Electron microscopy, glutaraldehyde. Frozen section fixes and mount histological sections. Removal of the tumor. After removal of the tumor, rapid determination of the margin. Now, some of the stains used to find the intracellular accumulation. For glycogen, we have carmine stain. This is the best stain. Other stains are also present, like PAS with diastase sensitivity. What is PAS? It is periodic acid ships. For lipids, we have Sudan black and oil red O. For calcium, we have von Cosa and Elzarin red. For trichome, we determine the collagen, which appears blue, and while smooth muscle appears red. Some others: for amyloid bodies, we have Congo red, thioflavin T. For JG apparatus of the kidney, and S. For hemosiderin, we have pearl stain. Thank you.